Thank you so much for staying with us. I want to talk about health security. Do you remember COVID-19? Well, it was just 2 years ago.
Who doesn't remember COVID-19? When our lives changed so drastically.
And one of the things that makes it rather outstanding for me and for many people is the revelation by the chairman of the Presidential Task Force on COVID-19 that, you know, he didn't know that we, as health infrastructure or apparatus, were so poor. And that was a shocker for him, even as secretary to the government.
Yes, and since then, what improvements have you noticed?
Well, there have been some improvement in some, you know, those, I don't know, what's the name of those things they built all over the country? I forgot. You know, anyway, well, those test centers and stuff like that, those laboratories. Our doctors who are guests this morning on this issue will be able to help. So how do we make this? Because, okay, just as you said, there are those who are asking, okay, so that was a revelation at the time. So what's changed?
Thank you.
How do we make it better going forward? And now that we're recruiting a new set of people to government to do things for us.
Time to take them up.
Time to take
What
them
are you planning for us in the health sector? Are we going to get better health services?
So that's why we have Dr. Gafara Laode with us this morning. He is Project Director, Prevent Epidemics Project, LISTEL. He joins us along with Dr. Emmanuel Hassan, who is a public health advocate. Both of them join us from our studios. In
a particular local government that doesn't have a health center, where does one go? What are you doing in that regard to make sure that there are health centers in every locality so that the people have somewhere to go to should they have any health issues? Not to mention, of course, the money they're going to pay when they get there. That's another topic altogether.
Health security and the universal health coverage that you are talking about in terms of people having access are two sides of the coin. If you don't make necessary arrangement for the basic primary health care services to be accessible, to be affordable, it increases vulnerability to public health emergencies, and it increases vulnerability to health security issues as well. So what you are talking about now, I see it from the prism of universal health coverage in terms of ensuring that Nigerians have access to needed health care, but with emphasis around without financial hardship, because there are instances where people sell their belongings, borrow money to be able to access the needed care. That is not universal health coverage we are talking about. We're talking about a situation where people have access to it. I think the various organs of government, they have put measures in place to ensure that, so for on the supply side of health, I think the National Primary Care Development Agency is working hard to ensure that at least there's one functional primary health care in every geopolitical world of the country. And then from the supply demand side, in terms of even with the services available, who is going to pay for it? So we have some policy, the government has a policy framework in place. So there's basic care provision fund, for instance, which by law is supposed to buy basic minimum package of services for all Nigerians by law. Of course, and then this is from 1% consolidated revenue of the federal government, which this present administration has started implementing. But are there gaps? Yes, there are still huge gaps because the policy framework is there. But in terms of the funding, adequacy of funding, the basic care provision fund that I talk about can only take care of just probably a fraction of the population of the country because of the amount of resources that is in existence. And that is why if you look at the coverage of health insurance in Nigeria today, only less than 5% of Nigerians are covered. And we are talking about universal health coverage. We want a situation where at least 80 to 90% of Nigerian population that will be covered by a very, very effective health insurance or financial protection mechanism so that when people fall ill, one, they will be able to access good quality care, not just any care. And then they will not suffer financial hardship So that's been, now that brings us to what the advocates in Nigeria are doing, trying to take advantage of this policy reset window that comes with a general election. If you look at countries that are doing well in terms of making progress on the journey of universal health coverage, there are some things that are actually common to all of them. And what is very, very common to them is that they started their process as a more of a political process than technical process. And they took advantage of the election period to really sell key policy trust that is very, very important, that will now become part of the manifesto of the political parties and manifestos of flag bearers, and which form the basis for holding them accountable. So that takes me to what a forum called Universal Health Coverage 2023 Forum, which is an assemblage of different partners, civil society, and donor agency, and well-meaning Nigerians that actually came together and say, how do we take advantage of this policy reset window? How do we put health on the political front burner? And when you say put health on the political front burner, you have to be very, very clear about what exactly do you want in health you want to put on the political front burner. And part of what this body has done is to develop what they call health agenda, citizen-led health agenda, or health manifesto in code, which actually articulates what are the key targets that we want to see in terms of improvement in healthcare across several parameters, which include the universal health coverage I'm talking about in terms of proportion of Nigeria that are covered by health insurance, looking at what, in terms of coverage of services, for instance, what proportion of our deliveries are attended to by skilled birth attendants. It will shock you to know that more than half of delivery that take place in Nigeria are not attended to by a skilled professional. In terms of immunization coverage, for instance, between the children between 12 months and 2 years, almost 70% of them are not fully immunized, which is very, very unfortunate. So across these parameters, the body has tried as much as possible to set target in terms of, when you are talking to the political, in the past, when the politicians want to tell you, they will say, oh, we'll make health free for all of us. Well, I don't say no. We want specifics in terms of what you really want to achieve within the 4 years, maybe as a president, as a governor, like Dr. Alassane said, as a chairman of local government, for instance. In your own contribution, what target do you want to achieve? And it's not only enough to set those targets. There are some key policy trusts that must be in place. You cannot continue to do things the same way, and to achieve if you want to achieve different results, you cannot continue to do things in the same way.
Okay.
So this body has actually looked at what are the key policy trusts that we want the political class to pay attention to, and for them to be able to achieve targets that we are talking about.
And what are these policy thrusts that need to be addressed?
Okay, thank you very much. So in terms of a key policy trust, so number one that we've identified is a policy trust around how do we optimize existing health resources in terms of man, money, and materials that we're actually deploying in the health sector. And the second dimension of the same policy trust is how do we optimize existing policy trust. Let me start with the optimizing existing policy trust. There are a lot of very, very interesting, very, very great policy trusts in the health sector today. Take, for instance, the National Health Act of 2014 make provision for a certificate of standard that any health provider, any health institution in Nigeria today, whether private or public, for you to be able to operate in Nigeria, you must obtain a certificate of standard, and that you must have some standard in place that qualifies you to operate in Nigeria, so that you'll be able to provide a good quality health services for Nigeria. Unfortunately, that is not being implemented yet. So in terms of optimizing policy, we want the political class to optimize that policy trust. Another important policy trust, the same National Health Act 2014 makes a provision for the Honorable Minister at the national level to provide annual state of the health report, which is going to be a very, very detailed report in terms of how, what resources has the health sector received, how has the health sector performed, and what are the issues, what are the challenges, which will form the basis for holding the system accountable. These are very beautiful policy trusts that have not been implemented. So coming back to the issue of man, money, and material that I'm talking about, the health financing landscape in Nigeria is grossly inefficient. It's grossly underfunded, but at the same time, the little resources that we are spending, we are not getting the best out of those resources.
Okay.
And that could be traced to even how we budget for health, in terms of we budget that's what they call input based, which is not actually targeted to in terms of what results we want to achieve and all those stuff.
Yeah.
So there are other policy trusts in terms
I know there are quite a number, Dr. Alawode, but let me ask Dr. Hassan this one, because you talked something you said the other time that piques my interest from the question, your response to the question Alara asked you earlier about let me just say it in a different way, imported diseases or imported infections and all of that. So I'm wondering how that is domesticated. Here is what I mean, Dr. Hassan. So are there policies that you think can protect our people to the extent that there are some things that should not be brought in to the country? There are some things, there are some practices we need to establish so that under no circumstance should these things be brought into the country as a way of protecting the people. Because ultimately, people go from the airports, through the major cities, through this, suburban areas, to the rural areas, because they want to go and see their people and all of those things, and they take some of these things and take to those people who have never seen this quote-unquote civilization. So, are there things that you think we can do to protect our people internally? Then we can now deal more decisively with the homegrown infections.
Thank you very much. I'll try to approach this from two perspectives. One, but at the end of the day, it will still be prevention, prioritizing prevention. So there are already laws in this regard. And for instance, the NCAA is part of the National Action Plan on Health Security, architecture. They are part and parcel of it. Office of, the National Security Advisor. All these offices and agencies are part of that. The issue is enforcing those laws. There are items that are banned, they are not supposed to come in. There are items that can come in, but they need to have been certified, they need to have been checked, they need to have been, declared fit for use, and they need to be packaged in a particular manner. There are rigorous conventions around all of those. What we need to do is to strengthen the implementation of all of that. So we need we need people who are aspiring to relevant offices in the land to say, look, we would ensure, I am aspiring to be so. I would ensure that we strengthen the laws that will make sure that diseases don't just walk in through the door like it has done in time past. And this should be done in a sustainable manner. And I should be able to, if I'm aspiring for a position, to state very clearly how I'm going to do that. The other side that I want to talk about is at the state and the local government and the community ward levels, you should ask your aspiring chairman, somebody who wants to contest to be chairman of your local government, somebody who is in charge of your ward, the councillor in charge of your ward. What should we do to ensure that even if, for any reason, a disease has found its way to the country, that in our own community, in our own state, we are able to educate the people, health promotion, citizen engagement, very, very important, to ensure that we protect ourselves. So at the practical level, it is important for, community associations, for CBOs, community-based organizations, to begin to engage their citizens and to tell them, increase the level of awareness, to also educate them to demand for more practical solutions. But I'll give you an example. One time I was asked to present a paper on the state of health infrastructure in my senatorial zone. And I couldn't go around, but I asked a few people to help me go around all the primary healthcare centers. And I tell you, in my mother's, the primary healthcare center in my mother's village, the pictures that came back to me was that of a center that had goats, and sheep, you actually sleeping in front of the primary healthcare center, and then, luckily, one of the local politicians eventually came to do something about that. We already have primary healthcare centers in practically almost every ward in Nigeria. Are they functioning?
That's the question. That's the question that I want to ask you, Dr. Hassan. That's the next question that I want to ask you.
Okay.
Perhaps the people themselves don't even know that these issues can become election matters, election issues. There are elections going on right now in Ekiti State. And I'm wondering, people like your mother's example that you give, for instance, people like your mom, wanting to say, okay, what are you going to do about health security in my village? Yeah. How do the people even know what to ask for? It's one of the, perhaps, you want to speak to how we, the people who know, can do that. Tell people these are the ways, these are the things to ask for from some of these people that want you to employ them into offices at whatever level, councillor, chairman, governor, House of Assembly member.
Thank you very much. And that is part of the objective of this kind of engagement, to begin to speak to Nigerians. And start from your community. Start with your community. I've had to personally engage youths and girls, in my constituency, so to speak, in my village, in my mother's village, to talk to them about health and to talk to them about things that we can do. That is from an individual perspective. I've talked about associations. We have village associations. We have branches all over in the urban centers. These are things that you should discuss, and these are things you should now engage with your chief or the king of your village, of your community. That look, during their quarterly meetings of, you could actually, the king of a village, for instance, can actually convoke a meeting to discuss these issues. It should be one of the key issues they should prioritize, to say, look, for our sons and daughters who want to run for elective positions, we want to have an engagement with you. We want you to tell us what you are going to do with regards to these primary healthcare centers that are probably, lying fallow without being used, or they are being used but they are not being optimized, or that, they probably supply health commodities, pharmaceuticals, and then they are maybe misappropriated or diverted. Those are issues
perhaps another question,
at the village,
Dr.
at the community
Hassan,
level.
if you don't mind me butting in, perhaps another question that you want to answer there is, do people even prefer orthodox medicine to what they are used to growing up? That's perhaps another level of conversation altogether. Don't answer that one yet. Or maybe I should ask
at the level of local government,
yes.
In the rural areas.
Yes, exactly. So, Dr. Alawade, you want to speak to that, perhaps even though the health infrastructure is, well thought out, people may not even know how useful, functional, important, or efficacious these issues are for them. To what effect then, as Dr. Hassan said, there are goats feeding and sleeping in front of a primary health center in a village?
Okay, thank you very much. I think what you just said actually reminds me of what our senior colleagues used to say medical school days. Then they would say, as a medical doctor, you are the third on call because people must have visited the herbalist and all sorts of people before coming to you. And it has to do with our health-seeking behavior generally, which is linked in most cases to the level of education because, multisectorial approach to health is very, very important. So coming back to the issue of health-seeking behavior, so it's a very, very important aspect of it. People need to have some understanding about the nature of, nature of sicknesses, what they need to do, where to seek help. And then it is when they know what to do, where to seek help, that is when there's gap in the supply of that health, that is when it becomes a significant issue to them. Because in the first instance, when they believe, and let me give you an instance to buttress your opinion on that. So there was a survey we did in one community because we wanted to roll out BedNet for malaria, for instance. And we discovered that, people were collecting the BedNet, which was supposed to prevent them from malaria, and they were using the BedNet for fishing. And when we were so shocked, I would try as much as possible to find out what was happening. And then we now stumble on the study done earlier on in terms of knowledge, attitude, and practice of people, where they would try to ask the question, simple question, what causes malaria, for example? And 80% of respondents said, oh, you have malaria when you stay too long under the sun or when you farm too long for a long period. So that kind of a person that never linked mosquito bite to malaria, how will he find BedNet useful? So that underscores the importance of community mobilization, health promotion, effective engagement of the community.
Advocacy.
Which is very central, so that people will be able to know simple, linkages between causes of diseases and the disease they have, and they'll be able to link it to the any treatment that you want to offer them. So that is very, very crucial. And going forward, that is now linked to the issue of citizen demand, even when the election period. So I engaged a couple of senators in the National Assembly, and I tried to find out, in your various constituencies, what do people ask you to do? He said, this is very interesting. I said, what number is health in terms of the list of demand of people? He said, Dr. Alao, don't let me lie to you. Out of the scale of demand of people, health should be placed around number 8 or number 7. First, people want money directly. They want you to give them money. And then they want jobs, they want infrastructure, and they want other things. They hardly mention health as a major issue. And then, what politicians want, they want more political capital. And by that, they want to do more of what people want as much as possible. So when they have little resources, they want to do physical infrastructure, what people can see. But how do we change this paradigm? And that is why part of what Dr. Alassane has said, taking advantage of the election period to engage the citizen as much as possible, to help them, to sensitize them. Some of those things they've already know. It's not everything that they don't know. Like, for example, everybody can tell you amount of money they've spent in the last 1 month on health, whether on orthodox practice or buying drugs from the chemists or visiting traditional healers and everything, which is a significant proportion of their income. And at times, some people have been thrown into poverty as a result of our spending. So if you try as much as possible to engage them with this and let them know it is because health system is weak. That's why they are spending this amount of money in the first system.
We could go on and on this conversation. We could go on and on. There are quite a number of so many things that, I mean, this looks like the topic for a symposium of like 3 hours. You're actually quite explicit in the descriptions and everything, the knowledge that you're sharing. But for now, we have to thank you very much for being a part of this conversation. And we also will take some learnings from this and raise those health issues with some of our guests going forward, so that we can make them the election issues that they ought to be. Dr. Gafar Alawade is Project Director, Prevent Epidemics Project, LISTO. Thank you so much for your time, as well as Dr. Emmanuel Ahazan, who is a public health advocate. Gentlemen, thank you for being here today.
Thank you very much indeed.
Thank you very much. Thanks for having us.
Yes, please. So Sunrise continues right after now. We'll bring you something else after the break.